Hi, I'm Reggie Rosignol, the new chair of Gloucester Resource Council, and moving forward, we are going to do our best to record the presentations that we have at our monthly meetings. And so this is our very first presentation doing so with Kendra Parsons and Debbie Lancucki. Kendra is the program manager for Healthy Families and has been with the program for 14 years. Debbie is the program director and has been in her role for 23 years this July. Debbie also initiated CREEC, which stands for Chesapeake Bay Region Early Experiences Council, in January 2023 in an effort to bring all of the stakeholders with services for young children together and to share resources and improve services for all children. Kendra, would you like to start?
As Reggie said, my name is Kendra Parsons, and I'm the program manager and supervisor for Healthy Families. Healthy Families is a program that serves our communities from prenatally all the way through the age of 7 years old. Our primary focus is offering parent support to the families, and what that looks like is different for each and every family that we work with and what their needs are. All the services are very individualized and offered in the family's home. We also provide lactation services for the families and for anybody within the community. We have multiple staff that are certified lactation counselors, as well as other staff that have been trained and are willing to help in any way that they can. And those relationships can be as much as a phone call or two, or somebody coming out to your home, or coming out to your home multiple times and having different follow-up to whatever the different individuals need. We also participate in a program called Purple Cry, which is an initiative of the Shaken Baby Syndrome. And that is an education base that lets parents know that this is just a period and it will pass. And that gives them opportunities to understand that in those crying periods and have positive coping skills to prevent shaken baby.
Yeah, that's a nice summary of our services under the Healthy Families model and for children and families that are just in there in the middle of parenting. And it does really look different this day and age. So we're looking at not the typical mom and dad or single mom. We're looking at grandparents or other relatives that are now charged and taking such great honor in raising children that they might not have intended on doing. So we're supporting those as well as foster parents. While children are being in the middle of going back and reunited with their parents or maybe on to adoption, whoever their forever caregivers are going to be, we like to be there with them. And some of the things that Kendra mentioned, the lactation and the purple cry, are fairly new to our program because as we've gone through the years, we've just expanded and based our services on what we see might be beneficial to the people in our community. So we kind of try to reach out beyond what we might be obligated or charged with doing through our grants and our funding revenues. So while we do meet primarily in the home, because that is the best place to meet the family's needs, we do other things in the community. We might meet at a park, at the library, and we do parenting groups, both in person and virtual, which we found parents really, really benefit from. So yeah, I think outside of that, that was so nice. We just really like to look at families right where they are, what they tell us that they want in their life and need, and it seems to work very nicely.
That's wonderful. And so if a family was interested in getting support for the children that they were raising or working with, how would they go about that? How do they reach out to you? Do they go through social services? What's the best way?
Yep, they can call our office and we're going to give all the numbers there. They can call me or Kendra. Our main person is right now Lynn Hudgins, and she does all the wonderful first steps for families, getting them information and kind of determining just where they are and what the best service is. So if a family makes a phone call
Mhm.
and we figure out, well, maybe Healthy Families isn't something that would really meet their needs right now. We are within an agency and a community that would be able to link them to something that will help them
Yeah,
and support them.
that's awesome. And I'll put the contact information in the description box of the video too.
Yeah,
Okay.
great.
So beyond the programs and the parent groups and stuff, but if a family needed something for their kids and they weren't sure who to go to, like if they needed a car seat or they weren't sure how to pay for medical type stuff, I mean, could they reach out to you just for direction in the community?
We will do everything we can to help. That's kind of our motto. But I'm glad you mentioned the car seat because we do participate in the Virginia Department of Health car seat distribution throughout the state. And we are a site that covers the 10 counties of the Middle Peninsula and Northern Neck. So if a family is in need and meets the requirements, willing to go through a little bit of training, then we are open to providing them a car seat that will keep their child safe
Fantastic. And needed.
and
Yeah.
needed. Yes.
That's lovely. Thank you. Is this where we turn it over to you now for CREEC?
I think so. So I'm really excited that Healthy Families really tries to look out and beyond, not just within the families we're working with, but what eventually will continue to support them. So we just look at our region, the 10 counties, as an opportunity to connect families. They are not stagnant. You know, families move from county to county, place to place. So we looked at what can we do to bring service providers, people that are working with children and providing these services together so we can have that continuity, that, you know, equitable access to those services. And mainly we're looking at just looking what's available for children everywhere, whether it's childcare, their first real experience out in the world without mom, dad, caregivers, and their first real education. Because at the end of the day, we want every child to get out there and be ready as they can to have the best opportunity when they hit the public school. So we started, like you said, Reggie, in January 2023. So just over a year and a half now into bringing those stakeholders together. We have over 40, between 40 and 50 participants now.
Wow.
We meet monthly as a large group. We have work groups and planning groups because we got a lot of workhorses that have a little more time to put in the extra work. We are setting some specific goals to achieve so that we can make sure that children 0 to 5 is our initial and primary target, but we're also working with any youth after that age. Just bringing together the community in what's happening. Some of the important things that we really want to do is just make local governments aware of what's in their community and what's needed. I think you can't do anything if you're not aware of what's missing and the impact it has long term. You know, we're all about short-term fixes here, but this group is really some short-term wins, but long-term outcomes.
Yeah, that's awesome. So when you talk about having that many partners together, you know, to meet like that, do you have a list? Like if a parent was interested in what resources were available for children, do you list all of those partners somewhere? Is there a website or anything like that we could share?
Well, we haven't gotten to a website. We just secured some funding this fiscal year. So starting in July, we're now trying to pull together what we can establish with the little bit of money that we have to do that. So right now, all the money is going right into direct service work, really hard work, and the glamour's out there. But yes, there are definite objectives and goals to have a central point of access and information for all parents. I need to mention in all of the stakeholders, all the public schools, the pre-K programs, special eds,
Okay.
we're of the daycare programs involved and families. We have to have parents involved. Healthy Families does that. That's where I learned this.
Yeah.
Everything I learned comes from Healthy Families on how to facilitate, how to include. So we know right now that the most important thing is don't go off doing something without asking the people who need it or we think need it. What do they need? What would be helpful?
Yeah,
So-
that makes sense. So the same question, if someone wanted to be involved in what you were doing with CREEC, what is the
Right
best?
now, call me.
Okay.
That's right. Yeah.
Okay, that's great. Are there any initiatives that you can share that have come out of that already, or?
Actually, we've had some real good wins. We had a daycare provider in a locality that was having trouble with her new licensing. She was due to be open the next day and had a complication. So she called me, and between myself and some other people on the committee, the council, we were able to make some phone calls, and the child care center opened right on time so that their first 50 people and all the children, 50 families with lots of children, did not miss work, did not get disappointed.
Wow.
So that's pretty huge. We have recognized that there's a discrepancy, and we hope to do something about it in the number of slots that are funded for preschool programs in the public school. Don't always match up. And this is a money game, but why can't we approach the legislator to exchange slots for a year? Because populations ebb and flow, and you don't want to lose your money for 1 year and then not have it for the next year because you didn't lose it the previous year. But what if you could exchange that slot because there are more 3-year-olds in the county right next door, and they need that pre-K program? And you've got the slots and the funding. Why can't we, within the state of Virginia, do that? So that is like one of the top things on our next to-do list, in just really tackling that. Now, that doesn't mean that's going to be a quick win, but we've been able to do that with other entities, like Head Starts, just being able to have them maybe exchange and look a little different, like, okay, well, you live in this county, but if you can get here, we'll put you here. And then that's where CREEC comes in. Where can we help with that transportation piece? So we look at the family as a whole. You know, it's not just the education piece. It's the food, it's the job, it's the housing, it's the transportation. It all works together for this family.
Yeah.
So a regional
great
approach
example.
is pretty good.
Yeah, great examples. Thank you. I don't know that I have any other questions, but I know that with Three Rivers, I am a parent and I have participated in some of your programming, and just to clarify what that means, like I've been involved in classes, and it was actually really helpful for me, like trying to curb some behavioral things with you know, stuff that comes up with your kids, and just getting someone else's expertise that spends more time in family groups like that, and being able to play off other parents. So, you know, I appreciate your groups, but parenting's hard and it definitely takes a village. So, and all of the resources, I mean, they're also important to families. And so thank you for your support there. But
yeah, and we don't pretend to know everything because things change.
Yeah.
But we certainly have seen a lot in our years of this job. So I really encourage parents, even if they're not participating in our program or any of our services, they're welcome to come after a conversation with staff to our virtual groups, or just have a phone call. I mean, it's tough out there. It's really hard to be an advocate for your child. We're seeing more families that are struggling with, where can I go for an evaluation? What do I do with my child's unusual behavior? This is different. I don't understand it. You know, what's out there? What's out there? We don't know everything, but for the most part, we're just about right there with the newest and whatever is available in the 10 counties, because that's what we do.
Yeah,
We're connecting families to those resources all the time.
It's so important. And Kendra, I don't remember if we said it when you were in your presentation, but did we talk, there's an age limit on your main group too, right?
Yes. Yeah. We can serve through age 5 with our Healthy Families model and through age 7 with kids that would need some additional supports on past that point of age 5.
Yeah. Thank you so much for that.
Yeah, and so
like I said, we can enroll them as early as as soon as they find out that they're pregnant. If they want to give us a call, we're happy to engage services at that point in time or anytime along that path.
Yeah, that's awesome.
And we're really, if I speak to people that go, oh, I just found out I'm pregnant and I got this, I got this. Well, you do. You do. You really do. But think about it as just that extra package. It's free. We're free and voluntary for that piece. If you're prenatal, you can come in and have the support that you need, which includes everything that Kendra talked about, lactation, just thought process of what am I going to do? How am I going to raise this child? What are my values? Am I ready financially? Do I have the housing? So we really think that the earlier, the better, as with anything in life, the sooner you start doing different, the better outcomes. So.
Yeah. Well, and you can never have enough support. So it's just amazing. Yeah. Well, thank you so much for your time. And I can't wait to share this with everybody in our Resource Council and hopefully other channels. And for those of you who are watching, our Resource Council, our Gloucester Resource Council meets the first Wednesday of every month. You can email gloucesterresourcecouncil@gmail.com if you would like to be involved. If you're a nonprofit that has an opportunity or service to share, or you need volunteers, or if you're an interested citizen in the community and you just want to hear what's happening in your neighborhood and learn how to plug in, we're the space to do that. And so look for more, and I'll put that contact information below. And thank you both so much.
Thank you, Reggie.
Thank you.